The Nkwanta Area Program finds its home within the expanse of Nkwanta South Municipality, embracing 23 interconnected communities. The area program commenced its work in the then Nkwanta district on 1st January 1995 and dedicated its course to improving the lives of 63,200 street vulnerable children and their families.
I worked with World Vision. I began as a project coordinator in the then community development projects. We had projects scattered all over the water region, from the south, as far south as Voti, and in the north as far as Pusupu and Tutukpeni in the Nkwanta district. I think we had 21 community projects, if I'm not mistaken. And the community projects who gave birth to the ADPs. And I had just started the Nkwanta ADP in about a year or two after I left.
When the area program began operations in January 1995, most basic schools were in dilapidated classrooms built with mud and roofed with thatches.
Over the years, before World Vision came, Nkwanta was Nkwanta district, which today we will say Nkwanta North and South, was only one district. And Nkwanta district itself was a sub-district then, until it became a district in 1989. Hitherto it was a sub-district and a Karachi district. And then in 1989 it became a full district comprising both North and South.
They've come to support in almost all sectors of the economy. And their most important area of intervention for me is education, where they've put up so many classroom blocks in almost all the communities that they worked in.
So, World Vision took it upon itself and cladded almost all the pavilions in Nkwanta. When I say Nkwanta district, that is both Nkwanta North and Nkwanta South. And the first pavilion to be cladded was Dediase primary pavilion, followed by Nkwansek pavilion, and later the others.
Now, when we talk of infrastructure, the most important one for the kids are the dual desks. If you go to most of our schools, they'll be writing on the floor, some seats on block and other things. But I can assure you, for the past years now, consistently, World Vision has been supplying furniture to our schools. At least not restricted to only the World Vision adopted schools, but to other schools as well.
Then, just after the cladding of almost all the pavilions, World Vision distributed furniture, that's dual decks, to most of the schools. I would say about 90% of the schools in both, that is in Nkwanta district, which we will now say Nkwanta North and South, because I could remember we sent some of the dual decks to Tinjase, Abonyanya, Damanko, even Nabu, Sibi. All these are communities or towns in the Nkwanta North district. And you talk of Nkwanta South, almost all the schools that had the pavilions, because it's like if once you clad the pavilions, where would the children sit? There was no furniture.
So with all these trainers in place, as and when we want to do any orientation, we already have the men, the trainers who can train our teachers. That is the sustainability aspect of it. Then again, with the facilities that World Vision has built around the schools, there has been a lot of engagement between World Vision, education, and then the beneficiary communities. And these beneficiary communities have been educated as to how to maintain the boreholes and how to maintain the toilet facilities and the hand washing equipment.
So not quite long, I even named I gave a name to World Vision. I started calling them Samensia, meaning if Nkwanta district had not met World Vision, what would we have done?
When the Nkwanta area program began in January 1995, access to water, sanitation, and hygiene, wash, at household levels was so poor that it was common to find especially women and children walking over 6 kilometers to the nearest streams or ponds to fetch untreated water for household use.
Another intervention area is water and sanitation, where they have given us so many boreholes. In fact, mechanized boreholes. I can say that World Vision Ghana introduced mechanized boreholes in Nkwanta before even the government or state agencies began to also construct mechanized boreholes. What we knew was the hand pump boreholes that we have for some of our rural communities.
My 3 years in World Vision, Ebansra Shewaha. Omoba no na community no ensure problem. Enti community no dit World Vision fo anim. Ema omo eje peni so meboa ye wo nsuo ho. Kane no na ye wo borehole kakra na so ensuye ntuni yetimi ko ensuo tenene mu ko sa nsuo omo nsu twen kakra. Enti ya twen kakra nti no school kwala asore ahomachi na omo ko sa nsuo bedware ko school na omo aye late. Omo entumi nya nsuo no ntem medware enko school anasa omo nsi omo nyoma no ntem nti ama omo use omo hye nyoma fi enum nsuo fi ema nyare wa bebre kire nkwala
omo abe me pipe afa yensen ye gbongun bio ubie pe na waji won nsuo na wo de akọ nia Olivier abe boa ye wo kro no nyina no so
wash facilities, water and sanitation. So in most of the communities where we have boreholes, we also have Watson committees who take part, who have been trained to take good care of and manage those facilities.
Omo pawe nipa enkron enti nipa enkron no mu no omo yeye mu miensa eko entity e fa sania ensuo no ye be hwe ensuo no areas no akipi ho neat eni sania ba bi no mu saya omo betimi asiesie am fra World Vision for biam say
through the World Vision initiated savings for transformation groups in the communities, most community members now have access to microcredits, resulting in improved household and family resilience.
Na bra susu group emba krom as ekrodium no yembi mu pese brebia da mfiase esa ne say ahonkyere ewe so pa me amegina asesiai mentumi enko school na adoso mentumi ndo
wuka asem no nkware ana ya nipa ye do ewo kromasi kroduam be ye do aye nyeska no ye nim ade aye diska na ede eye because we na koton ugari ana we diska no de adi be group we entity enu no ye o mama ya ati asese say every week we to ugari ana o bayra ube iska kakra na edisie wo ayi susu group no
na bra World Vision embaye o yempetem se omo be fa susu group yi emma ye nkyerɛkyerɛ no skapa se bia me amegina yi ma hu sika ni mani no se be te se bia 2 million ereko no na bia me hwɛ film na be hu se bia omo kan ska
me be hu World Vision for ehu se adwuma me ye no ebetimi aboa youth no ewo yempotem ha enti omo eframe na omo me interview efa adwuma no nyina me kyerɛkyerɛ omo se na etie nyina na omo hu se yade bi a eboboa ye area nti omo so support project no
tama mete wa na me yare me na me ntimi ya adwuma nti amasa na me ya kono akwa sa na me ya na ma adwane kono me ntimi anya saka adwane kono ana omo hu me bobo nti kono ba ya no ye kono di ye mbu afa nti amamu di omuti abom no mabuwa me omo yisuka ama me to machine ana me di ya adwuma ma ma betimi atu omoka
ska ya me ankasa na nka me hu bi da no afie me de me nsa esom ekenkan hwe Temi kura na aninje bi abami mu.
Ya di kan ji atumu de. Be e adwin say ye to sika na World Vision fa be de me kukuru sika no de aba office ntino. Ya nche dan ji ade no anso mu yiye. Nti first start na ye be start no ye to 10 cedi. Ena ya sha ase ato. Nti tam na ya be close no ya anya sika be 5 million ni bibi. Nti ya hu sika no ne ya ni say say awonto e o baby na enso ye ti baby ye bre.
Besin da me to kono ama me to machine me lu aka ho. Ndi se na ye me nu ana mo World Vision ti mi ya yuma na me de twan kwara no so.
Tini na ye no omo support full omo eto hives bibira equipment bia ye de tini bia omo etoy ayedi ema satinesi.
Mfaso pa yanya free ne mabobo yinti no aye de pasa say aka ye trimu enye say bia ska no bi ade abemai nti e wose yeso yenhwe say mboa omde aboa amanda ya brabo master atna yi amaye no yeso ye de beboa ye nuan ma omo free omo eba
mu kwei no me so mehwe say ni position na menyaye ana ahwande na menyaye sika kakra menyaye no me so me di be support youth no se ne be ya brebia no mehwe say mba organize omo enya saati bia ni mu ewura no na ma bobo ma no so manya ntitie no ebi ama omo.
Children face a great deal of violence and injustice, including child labor, child physical and sexual abuse, child neglect, and child marriage. Child marriage was a common phenomenon as 25% of children were married before the age of 18.
Damase, I am say mra World Vision buy no. Na ohwa na ye wosumase. Kura ohwa enye Islamintia na first no enyim se obetima akọwara akwada keto aba besi wo nkyɛn a ehu hadisi ne mu ka no na yɛhwɛ ye no dabi entisa isisi nkwada no mu.
We have realized before World Vision comes, we have realized that in terms of child marriage, there were a lot of problems within our vicinity over here. That children under age are always released to go and marry. And some, it has become a cultural factors that exchange have to come in.
So, World Vision consulted me over some of these problems, and we collaborated and tackled some of these problems together.
Into World Vision by no aton safre. You know, suffer no nyina eko. No say sana ema no se akwada enye nduru aware a ense se yanware no. So, omo ama yesa training no. Yejiatum ama yehu se womo a ye kire womo nkwada no no ajai na yema kasakasa de call nkurase kura ye namu yakwafa nkwada no bia nka ye wore womo nkwada na yampene so afa womo ade abese school.
They actually social welfare and church collaborated with World Vision in tackling some of these problems.
But ever since when this training went on, when World Vision invited us, we also came and trained other pastors with this regard. And I can vividly recall that in 2018 thereabout, we launched End Child Marriage in 3 communities, at Ashabre, at Bunache, and then Power. Then from there we extended to all the communities in Nkwanta Municipality.
So we educated them very well, and they seem to understand. And we carried out community educational programs in that area too. So for some time there has not been any issue concerning forced marriage in those areas again.
As I say, Sankwada no wamo eda World Vision as I say enka nye omo ntia enka omo ese asom entimi ndi mboa omo say ya.
And the sustainability that we have put in place is that we can't set once World Vision is leaving that thing to end over there, because if you want a program to be sustained, if you want an issue to continue to echo in people's mind, it means that the program needs to continue. We need to continue even in the absence of World Vision.
Yeah, if you say what was before, there was no situation, there was no health. Everything was so rudimentary. There was no facilities, there was no clinics, there was no, I mean, it's complete bush, okay? No road, no water, no electricity. There was no hospital. Well, St. Joseph had a clinic which they were doing outreach services four times a week. I remember the Reverend Sisters, Sister Anne, Sister Dolores, they go Kabiti on Mondays, go to, Tinjase on Tuesdays, go to Abrewanko on Wednesday, go to Pasa on Thursday. There was an outreach station. So when I came also, then there was a small clinic. In fact, the clinic was running from one of the nurses' quarters.
I think there's a hospital. And the doctor in charge was also a young man who had just finished medical school and was Dr. Wuno? Yes, Dr. Wuno. So I was spending most of the time with him and encouraging him, because there were not much facilities to work with.
You know, as a doctor, I've seen too many deaths in my life in this area, in Nkwanta area, particularly maternal deaths. And children, infant deaths, too many. And sometimes I try to recount too many deaths because there was nothing to do. People get sick, they get pregnant. The next place was Hohwe. Took about 9-10 hours drive. If you're lucky, you reach the same day. If you're not lucky, and many of them return on the way, because they died and they had to bring them back.
Also in health, we have some CHIPS compounds around Alupacha and nurses bungalows in Obanda and other places as well. So if I want to mention the areas and specific interventions that World Vision has given to the people of Nkwanta, it can take us so many hours.
Basically, the bigger challenge was like maternal mortality and lack of services in terms of immunization for kids. So children were dying from measles. Goiter was a major problem in the area. Guinea worm was so terrible. The guinea worm was a problem, and so we had to be fighting several things. So my concentration was not on a hospital or some public health. I have propagated the good work of World Vision for all many years, more than what World Vision itself has done. There's no international meeting, conference, or local that I do not mention World Vision. The support that World Vision has provided to alleviate poverty, disease, and hunger in this area. So, World Vision, kudos. I mean, you've done it. I'm not saying this because I'm talking to you. I'm writing a book, my memoir, and World Vision has a chapter in that book. Yes, as a way to show and demonstrate what organizations like yours have done to transform. Today, people who are here, they don't know what has happened. I don't know how much that people give reverence to World Vision, but at the time when nobody was here and nobody was prepared, World Vision was here. It was the only one that was doing. You see them everywhere.